want to welcome you both to our third session on implementing self-measured blood pressure. And today we're going to cover overcoming patient barriers with SMBP. Our objectives for today is we're going to talk a lot about understanding what motivational interviewing, and we'll refer to that as MI quite often. You'll see that on the slides for today. We're going to understand those techniques, what it is, and how we can incorporate motivational interviewing into our SMBP conversations with our patients. And we're also going to practice using some of the techniques such as open-ended and probing questions to help us gather more information when we're talking to our patients. And I just wanted to start, I'll just ask Teresa, you and Jennifer quickly, are either of you familiar with motivational interviewing? Have you done motivational interviewing before? Teresa's nodding her head.
Yep, I've taken, every few years I take a motivational interviewing class for our local PO office.
And Jennifer, are you familiar with it? Or?
Yep. So we take a class through ICSI when we're first started as a navigator, and then all of our trainings kind of all contain motivational interviewing techniques.
Oh, great. Well, this is going to be a big review for you guys then today, but we'll do a little practice too, and just kind of a go through what it all is, and maybe there'll be some things that will be new for you too. So we are going to start with our polling questions though, and I'll have Elena pull those up for us. And the polling questions are, what are the 3 steps to measuring blood pressure at home? And then the question is, a patient has a blood pressure of 180/20 or greater. They rechecked their blood pressure with similar results but had no symptoms. What does this mean? So I'll let Elena watch for the results. Sorry, didn't mean to talk over you, Elena.
You are A-okay. Still waiting on them.
Okay.
Okay, so the first one, what are the 3 main components to measuring at home? They are prepare, position, and measure. And then that second one, the patient didn't have any symptoms, so that one would have been hypertensive urgency. So we always suggest that if that's happening, they should definitely contact their PCP and get some further instruction from them. But if they ever have any type of symptoms, that's that hypertensive emergency, and they should definitely go to the emergency room.
Thank you, Elena. And as we've done in our past sessions, we're going to just kind of start again with a little bit of a round robin that reviews our action plan that we closed with last week. And so for Teresa and Jennifer, if either of you can go first, but just starting out, how are you enrolling your patients in SMBP? Are you using outreach calls, point of care, or other, if you'd like to share about that?
This is Jennifer. I'd say for us, it's outreach calls. And I think I talked about this last week, but based off our registry review process, those patients that are not meeting our blood pressure goals.
And Teresa, was there anything you wanted to share about the enrolling of the SMBP patients?
Just that, when COVID hit, we were just handing out blood pressure cuffs like candy to all of our hypertensive patients, and we didn't really have a good format for the education and the follow-up. So now we're going to have to kind of backtrack on that and come up with something so that we touch bases with the ones that already have it, and maybe more education, and then also enrolling new ones.
And Teresa, do you have designated patient trainers there, or are you thinking of, if you didn't, are you going to assign some?
Probably have to assign some of our nurses.
Okay. Jennifer, how about you?
Sorry, difficulties with the unmute. We would probably utilize our navigators. So we haven't started this, just learning about the process, but I'm thinking we'd use our navigators who are doing the outreach phone calls.
Well, hopefully the action planning is kind of helpful in helping you kind of get your programs in place, and so you can take from your learnings each week. So next, so like I said, today we're going to talk about motivational interviewing techniques today. And so we can get started with that. First, kind of a discussion question. See, I'm just asking you guys all sorts of questions today. So since it's a small group, I mean, you can certainly chat in your answers, but since it's just the four of us, if you just want to unmute yourself, we'd like to hear what are some of the reasons that you're hearing from your patients why they aren't able to manage or why they aren't managing their high blood pressure.
I'm hearing from our patients that it's the mask that's causing the high blood pressure. Like their face mask, and then just being at the doctor's office makes them nervous. And so it's in their eyes, it's not that they're not managing it, it's that our numbers don't reflect what their blood pressure actually is.
Oh, okay. That's the mask is, I hadn't really thought about that one since we're in COVID land now. So Teresa, what are you hearing from your patients?
I'm not hearing, I'm not on the floor, so I'm not hearing the in-person, but for patients who have like their cuffs at home, just not being as comfortable with their machines and not really trusting or understanding the numbers. I've heard just forgetting, or it's not a priority, so education and motivation play into that.
So that's great to hear too from your patients that are already doing SMBP. What are some of their reasons? So that's good to hear that feedback. So let's start with what is motivational interviewing. So as you both are familiar with motivational interview, but I'll just kind of review here. So motivational interviewing, it attempts to remove or move an individual from that state of indecision and uncertainty and move them more towards finding the motivation to make positive decisions and accomplish their established goals. And this is done, as you can see on the slide here, by expressing like empathy. So you want to build an understanding of your patient's issues, what their struggles are, what barriers they're having to improvements. So, like one of the barriers you just talked about is, in the office, they feel like it's like the white coat syndrome or wearing their mask. So if they're doing SMBP at home, that could be a way for them to remove some of those barriers that they see are preventing them from improving their blood pressure. You want to make sure that you're open with your patient when you do this. Make sure you give them have accurate disclosure and make sure that you're not judging or criticizing them. You also want to develop discrepancy by having the patients point out to you the difference between what they're doing and what their goals are. So looking at what those discrepancies are and seeing that difference. Also avoid any arguing or direct confrontation with your patients. You want to see the patient's point of view from their eyes. So if you can better understand the patient, you can be more supportive and help them acting to achieve their goals and be more, help them persuade to do that. Also, you want to kind of roll with the resistance. So meet the person where they're at and avoid the desire to correct their behavior. I always think of this when, whenever I talk to my husband about some issue I'm having, it always seems like it's their point of view that they're going to fix that problem for you. And we kind of want to avoid fixing that for them, but just kind of understand where they are at the time. So, you want to understand, as an example, that McDonald's breakfast every morning isn't going to really support their goals, but you can understand that they're busy and that's why they're going to McDonald's for breakfast. So help them take those small steps to achieving their goal. And then also support self-efficacy. Recognize their strength, highlight those, point those out to them so that they're aware of them, recognize their successes. Helping them, accomplish their goal, like we said, it's always the small steps, taking things day by day instead of trying to, eat the whole, what do they say? I can't even remember what the saying is though, but, take it one step at a time when you're trying to meet their goals. So when do we want to use motivational interviewing? So for SMBP, we're going to use it in the pre-SMP initiation. So we're going to use it to help the patient get started with their SMB program. And then we're also be able to use it in post-SMBP initiation. So talk to them, you can use it when they're first taking their device home, and we'll do examples of all of these. Also at that first visit after they've had SMBP initiation. If the patient, when they call in with their results, we can use it to support those results. If they're having difficulty with doing SMBP, talking to them about that is a good time to use motivational interviewing. And then also at the end of the program when they complete the program. So as I said, there's many different ways we can use SMBP or use motivational interview, in the SMBP program. So when they're first getting started, some examples here you'll see of some things that you can say to the patient that are helpful is it's difficult. We know it's difficult to understand your blood pressure readings. We have plenty of resources to help you understand them. And when you're monitoring at them at home, you can use these resources to recognize when you're in good range. Then you could also say, I understand it can be scary not knowing whether you have high blood pressure. I'm hearing from you that it's a concern that if you're diagnosed with high blood pressure, it will impact your life in a negative way. So just kind of being that understanding and caring and pointing that out to them. And as you may have noted here, we're using empathetic replies. So show that you're listening by summarizing what you've heard the patient explain to you. So if you want to use SMBP prior to the patient taking their device home for, I'm sorry, I got my acronyms mixed up there. When using motivational interviewing with SMBP, when they first take that device home for the first time, there's some things you can also use, some questioning that you can use with them. Again, something like, although it can be scary when you've been diagnosed with hypertension, unmanaged hypertension can create more problems later. So it's important that we address as early as possible so you can spend time with your grandkids for a long time. So kind of, again, bringing things from their life into what you're saying to them so they can relate it to their situation. And also just even asking them, what can we do together to make you more comfortable with monitoring your blood pressure at home? As you can see here, again, we used the reply to help develop the discrepancy and empower the patient. Okay, so on the next slide there. So after they've, again, started their SMB program, we can use motivational interviewing right after that first visit, after they've taken their blood pressure cuff at home. You might want to ask some things. What are some of the challenges you've had with SMBP? How can you work together to overcome these challenges? And what small steps can you make at this time? So again, looking at those small steps, being empathetic, asking what they can do. And if the patients say, if you send the blood pressure cuff home and they haven't used it or, reported any blood pressures to you, just ask them, how can we help you create a plan that will help you monitor? Don't shame, just, help them get to where they need to be. You want to make sure that you're, reinforcing those positive changes. And again, as I said, not shaming if, they haven't been able to do the work that you asked them to do. Also, after they do their self-measured blood pressure initiation, when they start giving their results is another time that you can use motivational interviewing. You can say things such as, wow, you measured your blood pressure, you recorded it for all 7 days. And then ask them what strategies did they use? What did they do to, be able to do that for 7 days? What did they notice about the results? Did they improve when they were measuring every day? Did it make them more aware of, maybe the foods they were eating or that they were exercising or getting enough sleep? Also ask them if they experienced any physical benefits when they were self-measuring. You want to, again, emphasize that positive so that, they can see that, when they're successful at doing the blood pressure measuring at home, that maybe, they can notice some of those physical changes that are positive for them. Also, you want to make sure you're encouraging your patients to ask questions, that it's a two-sided conversation and that, they feel they can ask you questions about the things that are happening. Also, when you're doing motivational interviewing for those patients, sometimes patients are going to have difficulty with SMBP. And so there's some things you can, questions or ways you can ask them through motivational interviewing, like, you know, what are their issues that are having, you know, you understand that life can be easy. So it's very easy to forget to measure your blood pressure. What can we do to help you do that? You know, what is it easier to do it in the evenings? Also, what makes you most likely to sit down and measure your blood pressure? So kind of help them work it into the routine of their life. And again, here, rolling with the resistance, you know, you want to come together to work for a solution, you know, making sure that it's working for them and that, you know, they can be successful. And then after your patient has completed their SMB program, it's another opportunity to use motivational interviewing. Ask them what are some of the positive things that they've noticed that now that they're measuring their blood pressure at home. What other healthy behaviors did they start practicing while they were doing this? And what do they want to do next? So, you know, kind of leave it open. They've had positive changing. What can you do next to help them improve and continue with their positive changes? So I know we covered a lot right there. I just wanted to check in and see if there was any questions on how we were using motivational interviewing as part of the SMBP program, getting people started. Any questions, any comments? I think too, it looks like we might have had some others join us on the call. Looks like Wendy. Hi, Wendy. I'm not quite sure. We have a 507-794 number. I'm not quite sure who that is. If they just want to either take themselves off mute and let us know, or else, you know, you can just put your name in chat too. That's fine.
I had a question, not necessarily about motivational interviewing itself, but about in practice. Is this an in-person or over the telephone? Is this a billable encounter? How are you seeing people use motivational interviewing?
You know, those are good questions. And I'm also going to let Elena, feel free to jump in, Elena, if you have any answers or any thing that you'd like to add. I mean, I guess when I've used most motivational interviewing, it's mostly been in person, but I know that's very different now with COVID-19. And you know, it is something that I think you could also do via a telehealth visit, which I know they've changed the rules on that, on billing of telehealth visits. Elena, just kind of let you jump in too.
Sorry, my internet is being a little spotty today, so I think I missed the front part of that, but is it wondering how you can utilize these strategies and bill for it? Is that the ultimate question, kind of?
Yeah.
Mm-hmm. Okay, I'm not exactly sure on that. I can follow up with a couple of the clinics that I work with and do some research on that and get back to you about that next week.
Be great. That would just help us kind of determine who would be doing it, when, where, that sort of thing.
And also, Elena, part of Wendy's question, correct me if I'm wrong, Wendy, was that do they have to be in-person visits, or, you know, can it be something done over the telephone or via telehealth?
Okay.
Any other questions, or I should check with you too, Elena, anything in chat that we should be aware of? Sorry.
I didn't see anything, but I got kicked off the meeting there for a little bit. So
okay.
If it was while I got kicked off, I might not have seen it. So if there's anything in there that anyone has questions about.
Okay. So this isn't in regards to the motivational interviewing, but I think, Teresa, it was you that mentioned you guys were handing out blood pressure monitors left and right during COVID. Can I ask where, is that something that your organization just chose to fund, or what?
I don't know all the specifics. First, we're going to find out if the patient can get it through the insurance, and we'll make the appropriate DME referral. Okay. But we are an FQHC, so we do have a large Medicaid, underinsured, Medicare. So I'm not sure of the specifics. It may have been part of a grant. I'm not sure, but we made that a priority to once we were going majority virtual visits, we made it a priority to purchase a certain amount to hand out.
Okay. Thank you.
That's a great question. And something I'll kind of get into next week about some like return on investment, because I mentioned that there are some of those billing codes that you can use for SMBP, and some of the devices that are eligible for that, because that adds an extra layer, is that there's only certain devices that they want you to hand out to patients to be able to recoup those billing costs.
Great questions, everyone. And just a reminder too, if you have any questions during, this is informal, please feel free to, ask questions, or again, you can put them in chat. That's easier. Next, we're going to talk, and this goes along with just the previous slides when we were talking about this initiating motivational interviewing as part of the SMBP program, is just a little bit here more about the stages of change, that are an important part of helping your patients get on board for anything that they're doing. This is probably going to be a lifestyle change for them, not only to do the blood pressures at home, but just even the changes that they'll need to make to better manage their blood pressure. So first, there's pre-contemplation. So this is really when the patient has, whoops, my bad, I hit a button, has no intention of taking actions in their foreseeable future. And we're usually defining that as like 6 months. So, they're unaware that their behavior is problematic and that it's having negative consequences. People in this stage often underestimate the pros of changing their behavior, and they overestimate the cons. So it's more, I have to have a McDonald's breakfast because I don't have time to have a healthy breakfast, because I, get up and have to be to work, within a half hour of getting up, and I just can't cook at home. Or it would take too much time to cook at home, a healthy breakfast. So contemplation, that's people, they start looking at, they want to start a healthy behavior in the foreseeable future. So again, we're defining that as 6 months. They're recognizing that their behavior is problematic. And so they're starting to give more thoughtful and practical consideration to the pros and cons. What can they do to change their behavior? And there's equal emphasis on both. So like maybe I can find a quick healthy breakfast to prepare at home. Even though as part of this recognition, people still feel ambivalent toward changing their behavior. So they might still not be getting right to where they need to be. And then the last step is that preparation. And that means that, they're ready to make that change within the next month. So it's not, long off goal. They're really, making preparations to start it soon. Like maybe they buy some exercise equipment, or maybe they buy, healthy ingredients to make healthy breakfasts. And it's small steps that they have to take. I think that's the biggest thing, in talking with your patients, is just reminding, Rome wasn't built in a day, it's, work on this one step at a time. And also they also recognize that changing their behavior is going to help them have a better life, or a healthier life, such as we mentioned in one of the previous slides, being able to spend more time with their grandchildren. Another one thing we want to notice when we're talking about the stages of change is that there are specific parts to that. So there's the action stage. And so that means it's maybe something that they have a recent behavior change. Again, we're kind of looking at 6 months for this. And this is a behavior that they've done and that they intend to keep moving forward. So it wasn't, just something, that was convenient for them to, stop going to McDonald's for breakfast. It's an intentional change that they're gonna, keep moving forward with it. And then there's the maintenance stage. So this is the sustained behavior change that's been for more than 6 months, and they're intent on maintaining that change. And they're making active steps to make sure that they don't have a relapse back to previous stages. So maybe they take a class on cooking quick breakfasts, or buy a deep freeze to freeze some healthy ingredients or fruit that they can use for their breakfast. Then there's the termination stage, and this is the stage, the desire to no desire to return to their unhealthy behaviors, and they're sure that they're not going to relapse. So a lot of times this is not always reached. People kind of tend to stay in that maintenance stage, And that's often, in this stage is often not considered in health promotion programs. So we don't always talk about this termination stage. There's also relapse. I know we don't have this on the slide, but this is where they might return to an unhealthy behavior after a period of success. So they've gone through all the stages, you know. You see this a lot when we're talking about people who quit smoking or quit using tobacco. There's a lot of variables that can contribute to this, especially for tobacco. So it could be things such as social influences, such as their friends and families and acquaintances, you know, people who are inviting them to go to McDonald's for breakfast or in Perkins and having an unhealthy breakfast. It's maybe part of socializing. I know kind of with COVID, people probably aren't going to restaurants for unhealthy breakfast so much, but, you know, some of it is stress, you know, talking a little bit about smoking, you know, there's using tobacco is a stress reliever. And there's might be lack of alternatives to their behavior, and that's why they relapse. So it's kind of, you know, we need to recognize that, and that relapse can be a part of this, but, you know, we want to help them get turned around and back into their healthy lifestyle. And here's just a visual map of those stages of change. You know, as you can see, it's a continuous circle: the pre-contemplation, contemplation, determination, action, relapse, maintenance, and back to pre-contemplation. You know, and you start at the top, of course, but, you know, after a person has completed the cycle, even anytime within the cycle, you can exit and re-enter. So I think it's important to know that. And I think it's important for your patients to know that, you know, relapse doesn't mean they failed. It just means, you know what, I'm just going to start again and you know, get you back to where you were. Here I have a video that gives an example of motivational interviewing for a patient with hypertension who is not taking their medication. So I'm going to let you watch this. It takes about 5 minutes. Can everybody hear me?
Good morning. How are you?
I'm good. How are you?
I'm good. My name is Suman. I'm gonna help you today.
Okay.
What brings you here?
Well, my doctor sent me here because he's concerned about my hypertension.
Would you like to discuss about your concern? Can you tell me about yourself?
Well, I recently retired from being an accountant at Air Canada for many years. I have 2 daughters. I'm living with my husband currently. He's been diagnosed with end-stage lung cancer. It's just too much for me to take care of him right now, and his medications are so expensive. Insurance does not cover them. So it's just, and now I'm working as a security guard. It's just very stressful.
Can you tell me how you feel about your health?
To be honest, I'm quite healthy. Never been sick. Though 6 months ago, my doctor had diagnosed me with hypertension. He gave me a list of medications, the diet changes, and exercises that I should do. I have a lot of other things on my plate right now. I just don't see the point in doing all that.
It sounds like you are feeling quite distressed regarding your current conditions. Tell me if I'm wrong, your current health status, your husband's health, household things, and finances are some of the stresses you are going through. Would you like to discuss with me what is the important thing to discuss at this point with me?
I would like to discuss my health in regards to my hypertension because I don't really know how to manage it in terms of with the medication.
As you mentioned earlier that you feel that there is no need to take the medication and you don't feel that there is any problem. Is it okay if we discuss what the hypertension is and what would you know about that and how you can manage it?
As far as I know, my doctor told me it means high blood pressure and then it can make me more likely to have a heart attack or a stroke, and it can be better managed with the medications if I take them. That's all I really know.
You are right. It is a high blood pressure and it is known as a silent killer. Mm-hmm. And you might not feel any symptoms, but it can really lead you to severe consequences. And research have showed that the medication, diet, and exercise, if we manage with that, we can prevent those consequences. Can you tell me what the main reason that made you not to take the medication?
Sometimes I just don't feel like I need to take it. I don't remember to take it, or I'm just too busy with my job and taking care of my husband. I just feel like life has no meaning right now.
Let me make sure if I understand you correctly what you said. The reason you don't want to take the medication you don't feel that there is a need, and you are so busy and the husband's condition is so distressing you for you. Can you tell me what are the main reasons that encourage you to take the medication?
Well, I want to stay healthy. I don't want to be in the hospital with a heart attack like my mom was a couple years ago. And I'm just scared of the feeling of not being there for my husband. So I want to be healthy so I can take care of him.
I just want to make sure what I understand is you want to take the medication because you want to stay healthy and you don't want whatever happened with your mother, and and there will be no one if you got sick who will take care of your husband. One hand you think it's not important because you don't feel the need, and on the other hand you think you need it because you want to stay healthy, you want to take care of your husband. Would you tell me how important it is for you to take the medication from 0 to 10 scale? 0 means not important and 10 means highly important for you?
Maybe a 7.
Okay. Would you tell me how confident you are if you decide to take the medication on 0 to 10 scale? 0 means not important and 10 means highly. 0 means you are not confident and 10 means you are highly confident on that.
I would give myself a 3.
Can you tell me why you are on number 3, not on number 5 or 0?
I feel that I'm not able to take my medications on time because of my job, take care of my husband, household stuff. So I think that's why my confidence is at that level.
What need to happen that help you to move on higher on the confidence scale?
Some sort of routine, maybe?
Do you have any plan to make a routine for you?
Well, I usually take a shower after work, and I feel relaxed at that point, so maybe I could link the medication to the shower. That will remind me to take it.
I think it's a great plan if you are relaxed on that time, and you will most likely to remember to take the medication. I'm wondering if we can discuss other ways that help you to remember with the medication.
Yes, I would like that.
I'm wondering if you can set your alarm on the phone around your shower time, and that will remind you in case you forget it. And I would suggest you, if you can monitor your blood pressure at home on the daily basis, or maybe three or four times a day, 3 or 4 times a week.
Mm-hmm.
That will give you more meaning when you see the numbers.
Sounds good. Those are things I can definitely do.
I'm glad that you are happy with this plan. Let's stick with this plan. Take your medication after your shower because, as you said, you are relaxed on that. And you can monitor your blood pressure at home. That will give you more meaning. Let's stick with that plan, and we will book in a follow-up appointment to see how your progress is going on. Anything else I can do for you?
No, this was a great help.
See you next week.
Thank you.
Diet and exercise if we manage with.
So what are some of the techniques that you noticed that we've maybe talked about that this interviewer used with the patient? And you can either unmute, or if you do want to put them in chat, if that's easier, that's fine too.
One of them that I need to work on more is asking permission to give out advice.
Yep. That was a good point. Yes, she did do that quite well. Anything else that others noticed, or? What types of questions did she use overall?
She had some good open-ended questions.
Anything else anybody like to share that they noticed during the video? And otherwise we can move along.
I was too busy with my job.
There, just trying to get it paused. Okay. Oh, there, it just wants to show itself again. So as Teresa mentioned, open-ended and probing questions, those are the next things we're going to be talking about as part of motivational interviewing. It is important, as we saw the interviewer doing here, to use open-ended questions. We want to avoid those questions that you can be answered by either a yes or no, because that just kind of ends the conversation right there. So like the question here, what did you think the self-measuring your blood pressure at home? They can't just say yes or no. They have to kind of explain what they felt, or how they felt about it, or how it worked for them. Also, you want to make sure that you arrange your questions probably from like a more general to a specific so that they kind of build on each other. So what do you know about high blood pressure, and what do you know about potential consequences of not addressing your high blood pressure? So that's, kind of starts out with that just general, and then getting more specific into the health complications of high blood pressure. Another thing you're going to want to do when you're asking open-ended questions is to ask broad questions first, and then queue up, have more of those cue questions are the second part of that. What do you need from, or what do you need to support you when you measure at home for this week? So that kind of be a question you could start with here as an example. And then from there, that kind of cues you up for the second question. Here's some resources to purchase blood pressure monitor at an affordable price. If you're not able to give out blood pressure cuffs, that's an example of that. But also you can just provide them with some other more specific resources, or if there's anything else that you think they might be needing. So as you can see there, the first question leads you into the second question for the open-ended questions. Along with open-ended questions, we have the probing questions, because open-ended questions can be kind of general, about what do you think, what do you feel, that type of thing. So the respondents might be answering you in a more general way. So that's why we want to get into more of the probing questions to find out more. It lets you to, collect more of that information. It provides clarity to the conversation. It also kind of lets them complete their thoughts, get someone into that more additional information. Also for probing questions, when you're probing for clarity, some of the things that you might want to ask we have here on the screen. So what do you mean when you say, and could you be more specific about that? I'm asking them to explain something, or could you tell me more about that? So, some of the questions that she was using to probe more about, asking her what time of day did she think she could remember to take her blood pressure medications. She talked about the shower. Why was that? Because then she was more relaxed and she was more tend to remember those types of things. So, again, it's kind of building on what you've already asked in the open-ended questions. And also when we're using those probing questions, if you're needing to get even a more clear response with the probing questions, you can ask additional things to get that more complete picture. It's important too that you don't want to say things such as when you're wrapping things up, don't want to say, is there anything else? Or because those can lead to like a no response. You want to make sure as you're wrapping up your conversation that it kind of leaves that opening for them to ask more, just in case everything, they don't have everything that they need to know for the day. So something like, what other questions do you have for me? And what other concerns do you have for me? So that kind of opens it up to them to ask more questions. Closed-ended questions we're giving an example of these here. You'll see such as, do you foresee any issues measuring your blood pressure? It's easy to say no. Will you need reminders? No, or yes, but it is measuring, once they've maybe been measuring blood pressure, how's it going? Okay, so you can see how these are kind of closed-ended. It can be that 1 or 2 word answers that really doesn't probe at what the situation really is. So here we've got some closed-end questions, and I was going to ask you if any of you have any suggestions of how we can take any of these 4 questions and turn them into more of an open-ended question. Anyone want to take a stab at any of the 4 questions or have any ideas? Jennifer?
Yeah, for the first one, the first one is obviously a yes or no. So you could say like, what kind of issues might you run into measuring your blood pressure at home, or what kind of barriers are you anticipating?
It's a good one. Anyone else have any ideas for any of the other questions?
Just the third one. Tell me about how measuring your blood pressure at home is going.
That's a good one. On the next slide here, we do have some examples for turning closed-ended into open-ended. And I do apologize. It looks like our bullets got a little off here. So when we originally had the first question of, do you foresee any issues measuring your blood pressure at home? You can ask, I think it was Teresa, or I'm sorry, I already forgot which one you said. What kind of issues might you have with measuring your blood pressure at home? So you came up with, you shared with us exactly how you can turn that one around. For the question, will you need reminders when you're doing your blood pressure at home? You can just say, what kind of reminders do you need to remember to measure your blood pressure? In that example, you know, she said, oh, I can do it maybe when I'm taking my shower. And then the other one was, how are things going with measuring your blood pressures at home? So you kind of led to this too. Tell me about some of your successes and challenges you've had with measuring your blood pressure. So that way it can get, even if it is going, you know, like maybe they're measure your answer to how is blood pressure measuring at home going, they say, okay, but maybe you can get a little bit more into, you know, they might have a few barriers that when you ask them about the successes and challenges, you can help them work through some of those barriers to make it even easier so that they won't have that relapse. Okay. Any questions about anything we've covered or anything you'd like anybody wants to share? Because I know a number of you have done motivational interviewing before and are, you know, doing some SMBP work. Anything that you like to share from that might fit in with this, or some of the things that you've maybe done with motivational interviewing?
Just from experience, my patients have been more likely to do things or make changes if it's something they suggested, as opposed to something I told them would be good for them.
Motivational interviewing kind of leads you to that too. You know, instead of us telling them what to do, when you're finding out where their issues are, it does kind of help lead, like you said, Teresa, to them doing things that they've suggested. Anyone else have anything to share? If not, and I'll just check, Elena, make sure that there's nothing in chat that I might have missed that anybody shared.
Not that I see, no.
Sorry about that. I had a cough a little bit too. My apologies. So as you know, we're going to end each of our sessions with action planning for the next week. So I'm going to show you our questions for next week that we'd like you to work on. We want you to write down 2 open-ended or probing question phrases that you will practice using in your conversations this week. And we can even, you know, talk about how those went. And then what are common patient barriers you anticipate hearing from patients regarding SMBP? So those are your 2 action planning questions for next week. And then the other thing is we would like you to bring a monitor to your next session, to our next session. And Elena, do you want to talk a little bit more about that?
Yeah, so if you have one, it can definitely be helpful to kind of follow along in the next session. I'll be going into kind of what the validation process looks like. So part of those CPT codes, the billing for SMBP, do require not only using a validated device, but also ensuring that they're accurate. So I'll just be going over that process a little bit. So if you have a device and you want to bring it along to kind of follow along with that portion, you're more than welcome to do so. It's definitely not required, but if you have one, feel free to bring it.
Yeah, I was going to say, I think you mentioned this too, Elaine, at the start when we were talking about some of the patients in your SMBP programs who had mentioned that maybe it was the monitor that was the problem. It wasn't that their blood pressure is high. So I think our session next week will be helpful for that. Are there any other questions or anything? And you know what, if you have questions other than motivational interview or what we covered today, that's perfectly fine. I don't want you to feel that you can only ask questions about that. So any other questions, any other comments that anybody would like to share? Well, if not, I am going to give you back 14 minutes of your day. Thank you, everyone, and we'll see you next week. Same time, same place.
Thanks, everybody.
Bye, guys.